Ashley, thanks. Well, mental health issues have really come to light during this pandemic as we are to quarantine. We're forced to stay at home. Now, this is affecting not just us, but also our children and our teenagers. Joining us right now is Dr. Tim Kearney from the Community Health Center. He has some advice for all families who are experiencing stress, anxiety, and struggling with isolation and also the pressure of homeschooling. Dr. Kearney, thanks so much for being with us. First off, I have to say, life has changed so dramatically, so drastically for all of us, and we didn't necessarily have a good amount of time to prepare mentally. So it's really not that unusual for our kids to be feeling some anxiety and stress and sort of just unsure feelings about what's happening right now, correct?
Yeah, that's absolutely true. Thank you for having me today. And I think what the key to understanding what's going on that we all need to hold in mind right now is we're all suffering from trauma. And those of us that work with traumatized kids and families professionally, we're familiar with the concept called secondary traumatic stress. And what that means basically is people hear about horrible events that are being faced by others, develop trauma symptoms themselves. And that means that we're all becoming irritable, having trouble concentrating, sleep problems, hopelessness, physical ailments. People tend to feel infective, down, depressed, apathetic, and that's even without adding in all the individual stresses we all face, the losses, whether we know people who are sick and dying or not. We've lost our daily routine, our schools, for many of us going to work, seeing people they care about. So that's the context we need to think about all that's going on right now. We're all experiencing trauma, and we all need to be kind to ourselves and to other people.
That's certainly a really good reminder. Now, doctor, I have to ask you, what sort of behaviors should we as parents be sort of keeping an eye out for? Things that might be sort of a red alert or alarming, that there might be something a little bit deeper, something that we might want to, follow up with a professional.
Thanks. Yeah, that's a really great question. You can expect that children they're going to be showing a lot of the same signs of stress and loss I just listed about above. And look, as parents, we all know our own children. So watch for any changes from their pre-COVID selves to who they're coming right now that seem kind of extreme. And it really could go either way. You could have someone who's really anxious, they're tossing, they're turning, their mind is going and running all the time, and they're not going to sleep well. On the other hand, someone could respond to the stress and the loss by being really depressed, and they're sleeping all the time. So the key is to be concerned if something's changing. But then, yeah, we all have normal changes to these situations. So is it something that's only occasional or really happening all the time? That's more of a concern. And is it something that's getting in the way of living daily life? That becomes more of a concern. So things like mood extremes, talking about death or suicide, crippling fears, turning towards unhealthy ways of coping, like overeating, using drugs, alcohol. All of those sorts of things are signs of deeper trouble. So by all means, reach out to a professional. And if it's a real urgent situation, it's always good to call 911 or 211, which will get you to the emergency mobile psych services for kids. And the professionals there can step in and help.
Now, doctor, up until a few weeks ago, you were seeing clients, patients in your office, but you, like everybody else, have had to adjust and you've switched gears to telehealth. So talk a little bit about the effectiveness of that and what your patients, the type of feedback that you've gotten so far from the switch.
Yeah, great. As a field, we already knew that telehealth was effective. Studies had been showing that it was just about effective as real life, face-to-face kind of treatment. And at the Community Health Center, we were already doing some trials with video treatment. We knew that we wanted to be able to bring psychiatric care to our school-based health centers, where we have, in about 100 schools, we have therapists delivering the same kind of care you'd get in an outpatient clinic at the school. But for psychiatry, people have to travel to the main site. So we wanted to bring that in. We also wanted to be able to provide services to those folks who were not able to get to the clinic for transportation issues or whatever. So we had about 4 clinicians up and running. Our plan was to move it to about 10. So instead, we moved it to 215, practically overnight. And what we have found was the biggest roadblock really was payment. The whole issue of reimbursement. We are dependent upon client fees to keep the revenue, to keep the lights on, to keep the doors open. And just as COVID was hitting, we were thinking, okay, we got to move over to telehealth, whether we're going to get reimbursed for it or not. In our situation, our agency depending on the site, anywhere from 70 to 90% of the folks we see are on Husky, on state insurance. And Connecticut stepped in and did the right thing. They really said, we really want to have folks that, for whatever reasons, are dependent upon the Husky system to have the same rights to get outpatient treatment by telehealth as private insurance has enjoyed for years. So we were able to get our staff up and running. And what we have found is that the clients really love it. Most of my clients, I see children and adolescents clinically in the Middletown site, and most of my clients are saying, do I ever have to go back? I love this. This is fantastic. And the families are really enjoying it because they don't have to travel. They're saving a lot of time. They're able to access their healthcare providers at times that they might not otherwise have been able to do because we've been able to expand our hours in this situation. And we are collecting hard data. We're doing patient surveys. We're doing staff surveys. We're really going to have the numbers to tell us how are we doing with this. But what we're finding is everybody seems to like it better, and it's very effective.
Now, doctor, we as parents, we're always focused on our kids. We always want to make sure that they're okay, that they're doing well first. But as parents, we also need to keep in mind that the better we are, the healthier we are, including mentally, the better our kids will be. And a lot of us parents are struggling right now. We have moments where, we're just really frustrated. We're working from home. Everybody in the household is all here together. We're all stuck here together. And then we're also dealing with the homeschooling aspect of things, which we're, not that very well versed. We're not teachers. So do you have any tips for us parents who are trying to cope and hold it all together?
Yeah, I do have a few things that's really for everyone, for all parents, certainly. And I have a special place in my heart for teachers now, which I think I've always had as a child therapist. But as I hear the number of kids who are dying to get back to school, missing their friends and especially missing their teachers, shout out to teachers for great jobs. But this is advice for parents and kids too, really, for that matter, translated to age-appropriate manners. First of all, everybody needs to give themselves some grace. None of us know how to do this. None of us have lived through a pandemic before. We've never sheltered in place with our separated from daily life, separated from our support systems while our loved ones got sick or died. I mean, no wonder it's hard for everyone. And stay in the present. Don't get distracted by fear of the future. There's so much that we don't know. And knowing is really, really hard. Focus on the facts. Whatever we do know, whatever you are able to do that. Focus on that and use the skills you already have. COVID-19 did not take away all that you are and all that you knew. And you can continue to draw on that. Think of what you've accomplished already. Use those same skills with your kids and with your family members and be creative. Get your kids to help make a meal. All the food's going to be the same color, or try the cuisine of another country, or do some relaxation and breathing exercise together. One of my favorite ones is smell the roses and blow out the birthday candles. And if nothing else, you'll all get to laugh at how silly you look doing it. But it does have a physiological response as well in our bodies. And then the last thing is stay hopeful. There are a lot of good resources online to help us get through this. People can certainly go to our website, www.chc1.com, and get a whole bunch of resources there. And we would be glad to try to help people connect with what's out there. As I mentioned before, 211 info line is still readily available, and always 911 for a psychiatric emergency. Don't wait. Get the help. If you think you need it, better to have called and have everybody said, oh, it really probably wasn't as serious as it felt, than not to get the help when you really need it. And lastly, stay hopeful. We're going to get through this, and we're going to get through it all together.
Absolutely, Dr. Kearney. Thanks so much for your time. We appreciate all the tips. And as you said, we'll just remember to stay hopeful, stay positive, and breathe.
Thank you
so much for being with us. And stick with us here on Fox 61. We do still have more ahead. Governor Lamont introduced a new app to track